I want to talk a little bit about the cruise ship, which you heard the announcement yesterday that a cruise ship was scheduled to return to San Francisco that contained individuals with flu-like symptoms. We are working closely with the Coast Guard, with the Center for Disease Control, and with the state to address this issue. We know it's important that we take precautionary steps before any consideration occurs to determine where this cruise ship will land. And I want to be clear with the people of San Francisco that we're doing everything we can to work with the state and the federal partners to prepare if it does come to San Francisco, but there are certain criteria that must be met before that occurs. So at this time, I want to ask the Director of the Department of Emergency Management, Mary Ellen Carroll, to talk more specifically about what that entails.
Thank you, Mayor Breed. Good morning. This is where we currently stand regarding the Princess cruise ship that was scheduled to return to San Francisco this week. At this time, the CDC, the California State Health Department, and the Governor's Office of Emergency Services with the U.S. Coast Guard are working to determine if COVID-19 is present on the ship. There are 2,383 passengers on board the ship and 1,100 crew members. Of that, a total of 35 have shown flu-like symptoms during the course of this 15-day cruise. Many of those people have recovered and are no longer showing flu-like symptoms. Testing protocols are being put into place on the ship for those passengers and crew that have shown flu-like symptoms or may have been exposed to the virus, and that is happening today. Once we have results from the tests, the CDC and the state will determine the most appropriate location for the ship to berth, and the location needs to provide for the safety of the surrounding community as well as the passengers and crew. The CDC and the state are fully engaged in determining a location that can most appropriately address the health of those passengers that may have COVID-19 and the safety of those passengers not impacted, as well as the surrounding community. The CDC and the state are considering a number of locations, including San Francisco. However, where the ship will dock will be dependent on if the location can enact the proper CDC, state, and local protocols and has the infrastructure to protect the entire community. Our main concern is whether we can ensure those passengers that may be infected receive the care that is needed, those passengers not impacted can safely travel home, and the health and safety of our local community. This is an evolving situation that requires the federal government, the state of California, and San Francisco to ensure all the best practices and protocols are in place to accept any cruise ship that may require COVID-19 mitigation. Thank you. Sorry.
Thank you, Mary Ellen. And I just want to say that San Francisco is embarking on territory that is not unfamiliar to us. You all know that we have some of the most incredible public health experts anywhere in the world right here in our city. We've dealt with challenges over the years, whether it was the HIV crisis or SARS or H1N1, and we got through those events because we came together as a city, because we put forward best practices, and because we continue to make sure that we communicate clearly on things that the public can do in order to make sure that we protect public health. Ultimately, that is our goal, and we will continue to do everything we can to make sure that as soon as we have information available, as soon as we have accurate information available, we provide that information, and that is what we are doing here today. So I want to thank you all for coming, and at this time we are opening up for questions.
Were tests administered this morning?
Dr. Colfax?
The tests were collected yesterday. The results came in this. Oh, I'm sorry. I'll let, with regard to the patients or the cruise ship? I will let.
So were tests administered this morning, and when will they get to the lab?
The tests are being administered today, and they will be headed to the California State Lab later today.
When will we get results?
We anticipate to have results early tomorrow.
If those tests are determined to be positive, does that mean the ship will be quarantined? And if so, where would that take place? Would that take place offshore, in the bay?
Christian, that's not our decision directly, but we will continue to work with the state and the port in making a decision that makes the most sense. So ultimately, we don't have an answer for exactly where the ship will be docked, whether there are people who are diagnosed or not. We don't have that information at this time, and once we know, then a decision will be made, and as soon as we know what that decision is, then we will provide that information to the public.
Can you tell people some of those protocols and procedures you're talking about? There's a lot of fear surrounding this. And
Yes.
failures with other cruise ships. Can
Yes.
you detail some of them?
Yes, so we're working very closely with the CDC. They are developing those protocols. We just want to assure you that the City of San Francisco is working closely. Once those protocols are developed, the CDC with the state will make recommendations as to what the disposition of the ship, when it can berth, and where.
And for those families that were diagnosed here in San Francisco, are their families quarantined? Or are they in voluntary quarantine? What is the procedure now to prevent people who are associated with those two presumed cases or confirmed cases? I'm not sure if they've been double checked at this point. But what is the procedure to prevent further spread from individuals who have close contact with those two patients?
That's right. So as we are speaking, our public health team of experts is assessing the families, their risk factors, and determining exactly what procedures we need to follow per CDC guidelines to ensure that their health is protected as much as possible, as well as transmission risk is mitigated and reduced as much as possible.
So at this point, we don't know if those families, the families of the 40-year-old woman in her 40s and the man in his 90s are quarantined.
We will follow the CDC guidelines with regard to that. So we will be monitoring them for symptoms, taking a close history to ensure that to see if there are any additional public health steps that need to be made, and whether testing is indicated at this time.
Has an office building on Front Street been closed in relation to either of these new cases that have been confirmed?
I am not familiar with that situation.
At what point do we close the schools in the city?
So there is conversation across the country about those type of interventions. There's no recommendation at this point to close schools regionally or by the CDC. We're monitoring the situation carefully.
And do we know if those people have taken public transportation at all in the last few days?
We do not have additional information at this time.
Can you talk about what led to those two individuals to be tested, since there's no testing on demand?
Yes. So over the past few days, the CDC expanded the testing criteria to include people who had serious viral pneumonia-like symptoms with not another diagnosis of another pathogen. So in typical cases, this would be people who have pneumonia that looks like a seasonal flu pneumonia, but they test negative for that seasonal flu pneumonia. So because our clinical team was very was watching these cases very closely, and because of the change in the CDC criteria, and because we received test kits here Monday, we were able to test these people who are eligible for testing based on those expanded CDC guidelines.